So the most important thing is that from a methodological standpoint, we are using this workshop to move forward the integration of patients, their needs, their perspective in driving our treatment. So this is something that goes beyond the specific topic. Then going into the topic, we have a lot of open questions, and in particular, how do we manage to choose the best outcome, the best procedure and meet the outcome of this procedure with the desires of the patient and what is possible to achieve from a professional standpoint. So one of the key outcomes of our working group is going to be this integration and an understanding, a better understanding on how to choose together with the patient, how to manage both single and multiple recessions.
Well, the starting point, as mentioned before by Mauricio Tonetti, was how the patient perceives the outcomes of these soft tissue augmentation interventions around dental implants. Not only how the patient perceives it, but also how the professionals look at the aesthetic outcomes of these interventions. But providing this information alone, out of context, is not very meaningful for those readers of this workshop. So we are combining this information, which is the prime information coming out of this workshop, with also the effect of the soft tissue augmentation interventions in the different implant-related procedures that are basically performed very frequently by dentists and specialists. And clearly, immediate implants is a very clear scenario. Treatment of dehiscence is another very clear scenario. And then we have a kind of combined scenarios where we can add these soft tissue augmentation procedures before implant placement, early or late in the implant therapy of these patients. So what we will try to do at the end is to provide answers, first to what the patient should expect and what the patient perceives, what the professional evaluates in terms of aesthetic outcomes, and what is the real effect of these procedures. So we can basically relate the effect of the procedures with the impact it has on the patients.
But I think there is something also very important, because in both of our two groups, we are trying to avoid having aesthetics as an isolated aspect. In other words, what I think is really the challenge is to integrate aesthetics, but making sure that this is still in the context of health, in the context of the medical dimension. I think it's important to make sure that we have a holistic view where aesthetic is only a dimension. What is your view?
And in our particular area, the prime therapeutic intervention is dental implants and implant-supported restorations. So what we are discussing, how by adding soft tissues we can improve both the effect of these interventions and the final outcome as it perceived by the professional or by the patient. But clearly, the outcomes related with peri-implant tissue health and also peri-implant tissue stability are of primary relevance in the discussions that we are having beyond the aesthetic outcomes.